Okay, hi Stella.
Hello.
I'm going to be doing your vital signs this morning.
Sounds like a plan.
All right, can I get your name and date of birth?
Sure, it's Stella Bellman, 02/06/1941.
And do you have any allergies?
No allergies.
Okay, great. All right, so we're going to start with your blood pressure.
Okay.
So you always want to make sure that you clean your stethoscope, especially the diaphragm. If this is your stethoscope, you don't necessarily have to clean the ears every single time, but it doesn't hurt. All right, I'm going to let that dry while I get ready with the blood pressure cuff. Thank you, Stella.
You're welcome.
He's got a nice long upper arm. So what we're going to do is make sure we apply the blood pressure cuff so that, can you turn your hand palm up? Great. So that your little artery symbol is right where it needs to be, where you're going to be checking for the brachial pulse. All right, the first thing I'm going to do is go ahead and feel for that brachial pulse. Okay, great. Okay, we're going to do first a two-step before we do the actual blood pressure. So what I'm going to do is locate your radial pulse. And then I'm going to pump up the cuff until I no longer feel that pulse. All right, that's about 140. I'm going to let that down. And what I'm going to do is add 30 to that number. So I'm going to be pumping him up to 170 when I actually do the blood pressure. So that's the first step of the two-step. Okay, so I'm going to let him just rest just a moment, make sure everything is down. Give him a little break. You definitely can ask your partner and or your patient to hold the gauge so you can be able to see it. It's just easier that way. When you have it on here, sometimes it sort of moves around a bit. All right, so I'm gonna pump him up to 170. Okay, I heard the first tone at 140, the diastolic at 78. Okay, so that's good. So I would document that as such. I'm going to take the blood pressure cuff off. Place it aside. So now I'm going to check his radial pulse. And if we're doing a checkoff, when we're doing a checkoff, I would be checking as a student, I would be checking this side, and the instructor would be on the other side checking the radial pulse as well. Then you need to wear a normal watch, none of the Apple Watch digital stuff. So you want to have a watch with a second hand. That's the big part. All right, so what we're going to do is I'm going to go ahead and hold his pulse and count for 30 seconds. And then I'm going to continue to hold his pulse and go ahead and count his respirations as well. And the patient's not so aware of you staring at them as you're doing the vital sign. So I'm going to start now. All right, so his heart rate was 42. I would double that because I did 30 seconds. So it's 84. And then his respirations were 20. So 10, and then times 2 is 20. So that would be his first part of his vital signs. So a part of vital signs, including the blood pressure and pulse and respirations, are going to be your temperature. Okay, most of the time you're using the temperature devices sort of like this. They're attached to the machines in the long-term care settings and such. But this is what you'll see most often. This is something that I do anytime I know I'm not putting this part in their mouth, but I don't know if somebody else did. So I always clean this off before I go ahead and get the cover on it. So I put the cover on, and you see all that popped up? Now you have a probe on, okay? All right, I'm going to place that under the patient's tongue. I'm also going to take into account if the patient drank anything cold or hot recently. So I would ask the patient that. And then once it beeps, then it'll give you your temperature. So beep, it say it did. And you will have a temperature located, a digital temperature there for you, and you would document that. Then this just gets popped off into the garbage can, like so. All right? And you can slide it back in here.